Good morning, everyone. So in this video, we are going to talk about the Section 1 FRCS Urology and what are the updates, what are the strategies for preparation. And so before we start, let us go through the basic structure of the exam. So we have discussed this previously as well. The basic structure of the exam is you have 120 questions in each paper. So you have two papers, and you're going to get around 135 minutes for each 120 question set. So that means you can roughly spend around 1 minute per question. We are coming to the basic tips for the how can manage the time better. Before that, in these 120 questions that you have in paper one and same in paper two, you can there is no particular division, like there is no particular uh, grouping of the topics. You can expect any topic to be asked in part one, paper one. You can be asked the same question sometimes, even repeated questions in the paper two. Okay, you can get oncology in one, you can get oncology in two, you can get urodynamics in both the papers. So it's not that there is a particular division. So don't get yourself preoccupied with that thought. You can get questions from consent and governance. This is very important because this consent and governance, if you know it, if you know the basic concepts of the NHS practice, then you can have a approach to those questions. You can get questions from ethics, the same thing, or the statistics. Okay, all these are important for your question. You can get overall 10 questions or sometimes 20 questions from this whole statistics and ethics. Okay, so you can have a lot of image-based questions as well. You can have images from malignancies, from your trauma, from urodynamics, from renograms. Anything can be sometimes gross pictures of the phimosis or the testicular injuries. You can be getting those questions, or lasers, or anything can be or resume. Sometimes they can just put a picture of resume. So there can be a lot of concepts or clinical scenario and a picture associated with it to reach to a particular right answer from the option. Okay. So how do you manage the time if you have such long clinical scenarios, complex scenarios? Then you have to understand which questions you need to devote time. So if the question demands time, you have to give it. You have to give the time to the questions. And sometimes some questions are just fact-based. You can have 2, 3 questions in 1 minute. So for example, the TNM staging can be asked almost 10 questions sometimes on TNM staging, half-life of the drugs, mechanisms, chromosomes, and all this. So these are some fact questions where you can save time. There are some long clinical scenarios where you need to devote time. The main thing should be your paper one should be completed at least in 2 hours, and try to save 15 minutes for your final revision. Okay, so what we are doing in our course is we are going to have 16 recorded sessions and 8 live sessions. 16 recorded sessions are quite different from what we normally discuss in the classes. In the 8 live sessions, we are going to have discussion of all the topics. So this is the course for the 8 live sessions. We are going to have sessions from the August, and we are going to take topics from each of these subsections. Okay. So we are going to have discussion on oncology, trauma, emergency, stone infections, everything. We are going to have 2 mock sessions in between to see the progress of the preparation and exam-like questions, so that we can familiar with the exam format as well at the same time. The whole thing is discussion of knowledge from every topic. It's mainly, so we are going to go into the depths. That's why the recorded sessions are there, so that you can go into the depths of the topics as well. But you should be having a knowledge about the entire urology before you jump into the depths or dig into the depths. Okay. So our emphasis will be on discussion of knowledge and to understand the exam format and take up all the questions so that we don't find anything unfamiliar in the exam. We don't find topics unfamiliar. We are quite acquainted with the format and the images, what kind of things we are expecting in the exam. So that is what we are all spending so much time in the preparation and in the course. So see you in the course. If you have any query regarding it, you can drop me an email. You can visit the website. We'll drop the link in the description. Okay. So thank you for watching this. Stay tuned and see you soon in the next month, early next month for the course. Thank you.